Welcome to the UC Quits Reducing Secondhand Smoke Exposure in Children webinar presented by Dr. Jyoti Marvin. I'm Catherine Saucedo with the Smoking Cessation Leadership Center, and I'll be your moderator on today's webinar. This is one in a series of 5 webinars designed to educate providers on tobacco cessation and health systems change. The UC Quits project aims to further reduce tobacco use and exposure, the leading cause of preventable death, by developing a UC Tobacco Cessation Network and UC e-referral system with the California Smokers Helpline. Headed by Dr. Eliza Tong from UC Davis, this ambitious project involves all 5 of the University of California Health Science campuses to ensure that every smoker receives support at every encounter. This system-wide collaboration is a historic change in how healthcare providers can ensure that smokers can get help to quit smoking by using the electronic healthcare record. Learn more about UC Quits at www.ucquits.com and the California Smokers Helpline at www.nobuds.org. And now I would like to introduce our speaker. Jyoti Marvin is a general pediatrician at UCSF Benioff's Children's Hospital, Oakland, where she works in the primary care and asthma clinics. She is also the principal investigator on the CEASE clinical effort against secondhand smoke exposure California project, funded by First 5 California, through which she helps to teach pediatricians across the state of California how to help parents quit smoking. Her research interests focus on the impact of tobacco on vulnerable populations, asthma, and using technology to help improve health of urban teens. Welcome, Jyoti.
Great. Thank you so much, Catherine. As Catherine said, I'm going to be talking about the CEASE program, which is a clinical effort against secondhand smoke exposure, reducing secondhand smoke exposure in children. The basic idea with this program is that we want to teach pediatricians to help our patients, parents, and caregivers quit smoking and to keep their homes smoke-free. For the next 15 minutes, I'm going to start by talking about the impact and prevalence of tobacco use. I'm going to talk about the CEASE program and then how you can use CEASE in your pediatric practice. We all know that tobacco is a major problem when it comes to the health of both smokers, but also the health of the people around them. Let's revisit some of the ingredients that we find in tobacco smoke to remind ourselves why tobacco smoke is so toxic, and toxic especially to children. Tobacco smoke contains things like hydrogen cyanide, which is found in chemical weapons, carbon monoxide, which comes out of the backs of cars, arsenic, which is a known poison. Lead was found to be so poisonous it was taken out of lead paint in the 70s. Ammonia is a household cleaner. Cadmium is found in batteries, and many more. And in fact, there are over 7,000 chemicals found in cigarette smoke, and 70 of those are known to be carcinogenic. This brings up the question, why do people smoke around their children? Everyone knows that smoking is not good for you, and everyone knows that smoking is not good for the people around the smoker. And so why is it that parents smoke around their kids? Working in pediatrics, we do know that 99.9% of parents really do want the best thing for their children. And so again, why do parents smoke around their kids? Well, the problem is that nicotine is so addictive. It's as addictive as heroin and cocaine. And quitting smoking is extremely difficult, as many of us know. 70% of smokers want to quit smoking. And it's incumbent upon us as pediatric providers to help and to intervene when we meet a smoker in clinical practice, and especially if that person is taking care of a child, we really need to be able to help that smoker quit by offering them both behavioral counseling and also by offering them pharmaceutical options, which I'll be talking about a little bit later. Now, why do we care about smoking and secondhand smoke exposure in children? Well, there are a few reasons. One is that smoking affects the entire life cycle. Starting in infancy, we know that infants exposed to secondhand smoke are more likely to die from diseases like sudden infant death syndrome and RSV bronchiolitis. We know that children exposed to secondhand smoke are more likely to have diseases like asthma, breathing problems, otitis media, and even ADHD. We also know from work being done that children exposed to secondhand smoke have cognitive problems. We know that the exposure of secondhand smoke is inversely proportional to reading and math scores. So it means that kids growing up in a home where someone is smoking are more likely to have trouble in school going forward. We know that teenagers who smoke are more likely to be absent from school. We know also that when a pregnant woman smokes, that fetus is exposed to cigarette smoke and to the toxins found in the cigarette. And then we know that that baby is more likely to be born low birth weight or more likely to be born stillborn. We also know that 90% of adults who are addicted to smoking started before they were 19 years old. And as pediatricians, that's on our watch. So it's so important that we're talking to families about smoking. We also know that there is no safe level of secondhand smoke exposure for children. We know that young kids are at increased risk for secondhand smoke exposure because they spend the vast majority of their time indoors. Kids spend 70 to 80% of their time inside. And when a parent lights up a cigarette, that child is not able to open a window or open the door or leave the room. And they're essentially a captive audience to a parent who's a smoker. We know that particular children are at highest risk for secondhand smoke exposure. We know that children under 12 years old, 54% of children ages 3 to 11 years old are exposed to secondhand smoke. We know that African American kids are 3 times as likely as other kids to be exposed to secondhand smoke. And we know from NHANES data that 60% of children living below the poverty level are exposed to secondhand smoke. We're also learning more and more about the emerging dangers of something called third-hand smoke. Third-hand smoke is the residue that's left over after a lit cigarette has been extinguished. And so it's that cloud of toxins that remains in the air. And basically those toxins are actually absorbed into the environment, into the carpet, into the walls, into the curtains, into the furniture. And then over weeks to months, even years, those toxins are emitted. They come back out into the air where they react with naturally occurring compounds in the air to form tobacco-specific nitrosamines, which are carcinogenic. And so creating a totally smoke-free environment is so essential for our children's health. We know from research being done at the Lawrence Berkeley National Lab and from UC Riverside that the toxins found in third-hand smoke can be dangerous themselves. They can cause damage to developing human DNA. They can cause elevated lipid levels and non-alcoholic fatty liver disease in mice models. They've also shown to cause poor wound healing and hyperactivity in mice models as well. So again, just another reason that we really want to keep a smoke-free air imperative with the families that we're seeing. And so how do you actually do this? When a parent comes in or a caregiver comes in and tells you that they are a smoker, what can we as pediatricians actually do about this? Well, we can implement the CEASE program, which again is a clinical effort against secondhand smoke exposure. And there are 3 very simple steps to the CEASE program. The first is to ask. And so we want to do universal screening for secondhand smoke exposure. So every time a child comes into clinic, we should ask about secondhand smoke exposure. And we also want to make sure that there's a system to flag the provider so that you as a pediatrician are aware that there is secondhand smoke exposure. The second step is to assist, and in this step, the clinician will actually prescribe nicotine replacement therapy. And the third step is to connect. And in this step, we want to connect the smoker to effective evidence-based behavioral counseling, which we can do by connecting them to the California Smokers Helpline. So before I drill down a little bit deeper into each of these steps, let's just pause for a moment and think about why is it that pediatricians should even be talking about secondhand smoke exposure and parents who smoke. The reason is that we as pediatricians actually have this amazing and unique opportunity to intervene when a parent or a caregiver is a smoker. There are a couple of reasons why. First of all, parents may see their child's healthcare provider more often than their own. In the first 2 years of life, a healthy child will see their doctor up to about 10 times. That means that we have 10 opportunities for interaction to talk with a smoking caregiver about their smoking and how it might be impacting their child. The second reason is that parents themselves may not have access to a doctor, and young, healthy parents, they just might not go to the doctor that often. And so again, giving people the access point of their child's pediatrician as a connection to the healthcare system and as a place where they can get help quitting smoking can be a really important and essential area in terms of giving them help for smoking cessation. And the third reason why pediatricians are uniquely suited to talk with families about smoking and smoking cessation is that many of us who work in pediatrics and many parents know that parents will do things for their children that they won't do for themselves. And so we have the opportunity in the pediatric visit to talk about the parents smoking in the context of their child's health and how they might be affecting their child's health. And because, as I said earlier, 70% of people actually want to quit smoking, that motivation of keeping their child as healthy as possible might just be that thing that some people need to learn more about and hear more about in order to actually take the steps to begin quitting smoking. We also are supported by both the American Academy of Pediatrics and the American Medical Association. Both of these influential bodies support the idea that any provider in any clinical context should be addressing smoking, both for the health of the smoker and for the health of the people around the smoker. And so let's go back to those 3 steps for the CEASE program. Step 1 is ask. And with this step, we encourage you to develop a system where you can ask about secondhand smoke exposure as one of the vital signs. So every time a child comes into your clinic, ask whether that child lives with anyone who smokes cigarettes. We want to ask at every visit, both a sick visit, because that gives us an opportunity to talk about smoking as it relates to diseases like otitis media and asthma and pneumonia, but also at the well visits, and so we have more opportunity to do preventive health counseling during those visits. And then again, as I mentioned earlier, figure out what your system in your clinic is where you can flag the provider so that the provider walking in the door knows that this is a child who's exposed to secondhand smoke. The second step is the assist step. And in this step, we use brief motivational interviewing techniques where the pediatrician actually talks with the family, talks with the caregiver who's smoking about their smoking, assesses their interest in quitting, and then takes the appropriate steps. A large part of the assist step also is recognizing the potent physiological addiction that happens with nicotine. And in order to help people with that physical addiction, we actually want to give them nicotine replacement therapy and medications that will help them break the addiction cycle. We ask pediatricians to write a prescription for nicotine replacement therapy, and you can get more information on this in the pharmacy module. And we also want to connect the family to the California Smokers Helpline as an alternate way to get nicotine replacement therapy in case there's a problem with the parent's health insurance. The California Smokers Helpline is a fantastic resource for people to be able to get nicotine replacement therapy. Why is it important for the pediatrician to actually write a prescription for the nicotine replacement therapy? Well, there are a couple of reasons. One is that by writing a prescription, the nicotine replacement therapy will be covered by insurance, and that removes a financial burden for the family because going out and paying for nicotine replacement therapy out of pocket can be expensive. Writing a prescription also sends a clear message to the parent about the importance of quitting and about our commitment to actually help them quit smoking. And to reiterate, you as a pediatrician are able to prescribe medication to help parents quit smoking. Nicotine replacement therapy is actually available over the counter. And by writing a prescription, you're helping to take away that financial burden. And so it's very helpful when someone is looking to start nicotine replacement therapy when they do have a prescription. And in fact, we actually prescribe medications to parents all the time. If a child comes in with scabies, we'll write a prescription for permethrin for the parent. Or if a child has pertussis, we'll write a prescription for azithromycin or other medications for the parent. And so this idea that pediatricians can actually prescribe medicine to the parents, it's not a new idea. We should be doing this for nicotine replacement therapy as well for parents who are smokers to help them keep their child's environment smoke-free. And please note that you can also bill for these services, and we have one of the billing codes up here on the screen. So the first step was to ask. The second step is to assist by providing brief motivational interviewing and then providing nicotine replacement therapy prescriptions. And then the third step for the CEASE program is to connect. And in this step, we want to connect the smoker to evidence-based, effective interventions that will help with the behavioral counseling part of managing the addiction to nicotine and the addiction to cigarettes. And the wonderful resource that we have in California is the California Smokers Helpline, and you can learn more about the California Smokers Helpline in another module. We actually can refer to the helpline in a couple of ways. One is that we can simply give out the 1-800-NO-BUTS phone number to the smoker and ask them to call the helpline themselves. We have found it's much more effective when we actually proactively do a referral to the helpline. And so either using the electronic health record system or using the web-based referral for the California Smokers Helpline, where we actually submit the smoker's name and phone number, with their permission, of course, to the Smokers Helpline, and they will actually receive a call back from the Smokers Helpline in order to initiate the counseling. It's important to note that for those of us who have parents of our patients who are either uninsured or undocumented, the California Smokers Helpline is also able to offer services like free nicotine patches. They have a number of grant-funded programs, and if the parents fit into any of those programs, they are eligible to receive some free patches from the Smokers Helpline, which can be very helpful. There is also a $20 gift card for Medi-Cal members who ask for it when they're initiating counseling with the Smokers Helpline. So hopefully these are things that will help encourage your smoking caregivers to connect with the helpline. They've got wonderful incentive programs, and we know that when people use both nicotine replacement and counseling, it actually doubles their chance of successfully quitting at 6 months. So the next steps are for you as a clinician to think about those 3 steps and think about how this would work in your clinic. So who is actually going to be doing the asking of the questions? Often it's the medical assistant or the rooming provider. How are you going to prescribe the nicotine replacement therapy? We have a number of tools available through the CEASE program, and if you send us an email, we will be able to help you with those tools. And then the third step is the connection and thinking about how your practice will actually be able to make referrals to the helpline, whether it's using the EHR-based referral tool for the helpline or whether it's using the web-based referral. That brings us to the end of our talk. In summary, please remember that both secondhand smoke and third-hand smoke have a major impact on children's health, and that the CEASE program can help to protect children from secondhand and third-hand smoke. And most importantly, that you as a pediatric provider can and should offer behavioral and pharmaceutical support to parents and caregivers who are smokers. If you're interested in learning more about CEASE, please email us at the email you see on your screen, and feel free to visit our website at www.ceasecalifornia.org. Thank you very much.
Thank you, Dr. Marvin, for your presentation on reducing secondhand smoke exposure in children. Free CME and CEUs of up to 0.25 credits will be available for those who complete this online activity. The webinar link and instructions to claim credit will be posted on the UC Quits and CME California website. For questions on the UC Quits project, please contact Dr. Eliza Tong. And thank you for your time.